Hi, my name is Lucas Shingle, and I'm a clinical specialist radiation therapist here at the Walker Family Cancer Center, Department of Radiation Oncology. What is OROC? OROC stands for the Orthopedic Radiation Oncology Clinic. This is a multidisciplinary clinic offering a fracture risk assessment for patients with cancer that is spread to a weight-bearing bone. The OROC team consists of Dr. Robert McCloy III, Orthopedic Oncology Surgeon, Dr. Adrian Ishkanian, Radiation Oncologist, and 2 clinical specialists in radiation oncology, myself, Lucas, and Julie Blaine. What happens in the OROC clinic? The goals of the OROC clinic are to identify patients at risk of pathologic fractures of weight-bearing long bones, to provide education to patients about their fracture risk and weight-bearing restrictions, to provide rapid access to radiation therapy if needed for metastatic bone disease, to provide timely access to surgical interventions if required, to reduce pain, improve quality of life, preserve function, and minimize fracture risk. The OROC clinic provides the following services: diagnostic imaging pre-assessment, comprehensive interdisciplinary patient assessment, orthopedic stabilization opinion, radiation therapy recommendations, weight-bearing restrictions and recommendations, multidisciplinary referrals as required, urgent response team, outpatient physiatrist and rehabilitation services, Niagara prosthetics and orthotics. How to refer to OROC. The clinical specialist radiation therapist, also known as CSRT, is the coordinator between referring physicians and specialists. The CSRT triages referrals, coordinates rapid access radiation therapy services, and is the primary contact and patient navigator for the OROC clinic. There's an online referral form shown above for community referrals to the clinic. If it is an emergent or urgent referral, please contact the orthopedic surgeon on call. You can find a link on how to refer in the comments below.
Hi, my name is Dr. McCloy. I'm an orthopedic oncologist here at the Walker Family Cancer Center in the Department of Surgery. What can you expect from your OROC consultation? The first step after referral to OROC will be getting diagnostic x-rays of your bone in the Department of Radiology at the Walker Cancer Center. X-rays are typically taken the day before or the morning of your consultation appointment. These x-rays will be ordered by the OROC team and used together with clinical physical examination and review of all your diagnostic imaging to determine the risk of fracture and any weight-bearing restrictions. The OROC team will determine your risk of pathologic fracture from high to low. The team will then advise you of specific weight-bearing instructions. Weight-bearing is the amount of weight that you can put on the affected limb. These are the following categories of weight-bearing. Non-weight-bearing. No weight is to be put on the affected limb. The affected foot must not touch the ground when walking, or your affected hand must not be used to support any of your body weight. Toe touch weight-bearing. Minimal weight is allowed on the affected limb. Your foot or toes may touch the floor to maintain balance but cannot support any weight, i.e., not enough weight to crush an eggshell under your foot. 50% weight bearing. Your affected limb can support up to 50% of your body weight, enough to stand with your body weight evenly supported by both feet. For walking, 2 crutches or a standard walker are necessary at all times. Try using a bathroom scale to see what this feels like. Protected weight bearing. You can stand or walk as tolerated, but walking aids must be used at all times, such as a stationary walker or a rollator walker. Weight bearing as tolerated. You can support 50 to 100% of your body weight on the affected limb. The exact amount depends on how much you can safely handle. Types of treatment provided by the OROC clinic include prophylactic surgery. If prophylactic surgery is recommended, the orthopedic surgeon will review all the risks and the benefits of the procedure. Consent will be obtained and instructions will be given to you about when and where the procedure will occur. You will be admitted to the St. Catharines Hospital with instructions. After the surgical procedure, you will be given instructions on ambulation and physiotherapy. You will typically be discharged home 2 to 3 days after surgery. The wounds will be bandaged and staples will be removed in approximately 10 days. You will then have a follow-up appointment scheduled in the OROC clinic to discuss post-operative radiotherapy. You will need updated x-rays prior to this appointment and the OROC team will arrange this for you.
Hi, my name is Adrian Ishkanyan. I'm a radiation oncologist here at Walker Family Cancer Center, Department of Radiation Oncology. Radiation therapy for cancer in your bone can be given before, after, or in place of surgery. Every case is different. Your individual need for radiation treatment will be determined during your consultation. Radiation therapy is generally delivered in 5 treatments, although on occasion it's given in 1 treatment. Remember that each person's treatment is individually designed. After you've signed consent for radiation therapy, a CT simulation or mapping study will be performed in the Radiation Oncology department. This CT scan generates images of your bone and post-operative surgical hardware if you had surgery, and will be used for radiation planning. You do not need to prepare for this appointment, and it should take approximately 45 minutes. Once you arrive in the radiation department for your mapping study, you will enter the CT simulator room and lie flat on your back on the simulator table. The radiation therapist will determine a comfortable treatment position for you. This will be your position for every radiation treatment. The therapist will then put some markings and stickers on your skin near the treatment area for the scan. When the scan begins, you will need to lie as still as possible. This scan takes approximately 5 minutes. Once it's finished, the therapist will put small permanent markings called tattoos, the size of a freckle, on your skin, which are used to align with lasers that position your body in the room. This ensures a reproducible setup for daily treatment. Once the simulation is done, you will go home and you will be notified by telephone when the radiation planning process is complete and when treatment is scheduled to begin. The radiation oncologist, radiation therapist, and medical physicist perform quality assurance checks to ensure a high-quality, individualized plan for treatment is created for you. This process can take between 3 to 7 business days.
What can you expect on your first day of radiation treatment? On the first day of treatment, you will register in the Walker Family Cancer Center on Level 1. The radiation therapist will escort you to a quiet space to go over any questions that you may have. You are shown to the waiting area near the treatment units and instructed to wait in that area for treatment. When you are ready, a therapist will greet you and bring you into the treatment room. You will lie down on the treatment table in the same position as you did for your mapping scan. The radiation therapists uncover you to locate the permanent setup markings. The radiation therapists raise the treatment couch and adjust you to line up the tattoos with the laser lights on the wall. Once you are in position, the radiation therapists check measurements and the treatment machine will rotate around you. The radiation therapists leave the room and are in the console area just outside, where they are watching and listening to you on closed-circuit cameras. The treatment machine will rotate around you for a few minutes, and the therapist will assess the scan from outside the room. If acceptable, the therapist will apply any final adjustments needed before radiation treatment and will let you know over the speakers that treatment is about to begin. While you are receiving radiation, you won't feel or see anything, but you may hear buzzing or a humming sound coming from the machine. You'll see the machine move slowly around you, but it will not touch you. Treatment typically lasts about 5 minutes. Once treatment is complete, the therapist will enter the room and bring you back out to the waiting room. You will meet with the nurse and doctor once a week after your treatment to discuss side effects and to answer any questions you may have. Possible side effects. Everyone is different. Some people experience mild side effects from radiation and others experience side effects that require management with medications. If you experience any side effects during treatment, please speak to your care team for management. Frequently asked questions. How long will treatment be? The longest part is setting you up and checking all the measurements. You can expect to be lying on the treatment table for approximately 30 minutes daily. Will I be radioactive? With external beam radiation, you are not radioactive. You can visit family and children, cross the border, and continue with daily activities as normal. Can I drive home after radiation? If you are feeling up to it, you can drive yourself to and from your appointments daily. Listen to your body. How long will side effects last? You may experience the worst of your side effects 1 to 2 weeks after radiation treatment is complete. After that, you should notice the side effects subsiding over the next few weeks. In rare cases, you may experience pain after your first treatment. If this occurs, don't worry. It's not the sign the radiation is damaging your bone, but please contact our team for management or visit your nearest emergency room. What happens after my radiation is complete? You'll have a follow-up appointment with your team typically 6 to 8 weeks after radiation in the OROC clinic. Follow-up x-rays will be done the day before or morning of your appointment. These will be arranged by your team. The purpose of these follow-ups will be to assess the outcome of your treatment and make recommendations regarding weight bearing, any need for outpatient rehabilitation and physiotherapy, and advise you on how best to return to your normal lifestyle and activities. If you have any questions between appointments, you can call the phone number for the radiation therapy department on your treatment schedule to speak with a member of your care team.